So hello everybody, welcome to today's webinar. My name is Chris Galvin. I'm the Head of Communications and Outreach here at ICOCA. Thank you for joining us today. The discussion today will last for an hour and we'll be talking about maintaining responsible security amidst the COVID-19 pandemic, providing you with insights specifically from Africa. Just a housekeeping thing, we invite you to ask questions throughout the webinar, but I would ask you please to submit your questions using the Q&A module. Please don't use the chat, it makes it much easier for me with the Q&A. So, with no further ado, I'd like to just very quickly introduce our panelists for today. We have Frank Amoyaw from Landmark Security. He's CEO of a member private security company in Ghana. Beatrice Godefroy is director with Center for Civilians in Conflict, CIVIC. We have Fred Nwogu, who is a programs manager at the New Nigeria Foundation, CSO member in Nigeria. And Wanga, who is also a member of ICOCA, on the board of directors along with Beatrice. Caleb is the coordinator of Usalama reforms in Kenya. So just to kind of provide a very kind of quick overview to get the conversation started, I wanted to just lay out a couple of data points and issues that will lead into the conversation. So yesterday, there were reported 31,000, just over 31,000 cases of COVID-19 in 52 African Union member states. There have been, as of yesterday, 1,390 deaths so far. Africa has gained, the African Union and the African Center for Disease Control has received much praise from the likes of the WHO for quite quickly acting on this pandemic, much quicker and in closer coordination than the EU, for example, having been coordinating intensively since kind of mid-February. And there have been many countries who have really quite restrictive lockdowns across the African continent, not all, but quite a number. And whilst the pandemic may have been contained, there are now issues arising, garnering more and more media attention about the impacts, the restrictions, social distancing, the lockdowns may be having, particularly for the most vulnerable populations in Africa. There are, potential food security situations. There are cases that we've heard of excessive use of force being used in various lockdowns. And so this conversation, it's a very dynamic situation at the moment. I think it's a timely conversation. We're looking forward from the insights from our panelists. And I want to first turn to Beatrice, because Beatrice has worked with Médecins Sans Frontières and WHO during the Ebola crisis. And Beatrice, I just wanted to kind of get your insights on having worked, on a health crisis there. What are the kind of themes and lessons learned, particularly from the point of view of security that we should be thinking about now during this current pandemic?
Sure, and thank you very much for inviting me to this webinar. I'm glad that we can have this conversation today. So I'm happy to share a few lessons learned from, what I've seen during the Ebola crisis, but also from what we're seeing today in the field, because CIVIC has programs in different places in Africa, including in Nigeria and the Sahel. And we can already see quite a number of let's say, specificities or differences with the Ebola outbreak. I guess, you know, one of the takeaways from the Ebola outbreak, which was also true from other major disasters like Haiti in 2010, the earthquake or the tsunami in 2005, 2006, is that when you have large-scale disasters or epidemics or outbreaks, the military and security forces are being brought in to provide support that neither the civil society or governments are able to deliver. For a question of capacity most of the time, or just to increase the capacities of those. So typically in Ebola, during the Ebola outbreak in 2014, 2015 in West Africa, they were brought in to provide logistic support. That is, you know, transportation of people or building Ebola treatment centers in order to increase the capacity of the number of hospital beds. These type of things, or support in warehouses, etc. They can be brought in as well to increase the support in terms of the health facilities. You have, especially in the military, you know, military doctors, military medicine, and you can mobilize this capacity in an outbreak. That's what we are seeing today, actually, as well in European countries, for instance, and in a number of capitals. And then there is using security forces and the militaries to enforce measures, including restrictive measures that are a part of the response. During the Ebola outbreak, you know, the health response, the public health response was quite different than the one that we are seeing during coronavirus, because the strategy that was followed by the WHO and the countries was to really identify the cluster of cases, do some testing, isolate contacts, and try and really hunt the disease cluster by cluster, so to say. While what we have seen with the coronavirus, let's say it's a virus that spreads so fast that we could not actually have this type of public health strategy. Therefore, the lockdowns and the quarantines are much more common in this outbreak response than it was in the past, in the Ebola one, for instance. So maybe switching to what's specific with coronavirus and also with the type of things that we're looking at civic, is that, you know, the Ebola outbreak in 2014, 2015 was mostly the most infected and affected countries were Sierra Leone, Guinea, and Liberia, which were not conflict places. While the coronavirus outbreak doesn't really make a difference between, again, Western countries, Southeast Asia, stable environments in Africa, or unstable or conflict countries in Africa. And that adds actually a certain number of complications or threats for civilian populations which are living in those areas. The first one is the the increased vulnerability. Loss of income, no access to livelihood, no access to agriculture for those which are, you know, impacted by the lockdown measures, but also in the context of potentially similar or increased military activities, which is what we see in some areas. In the Sahel, for instance, the number of attacks by armed opposition groups has not stopped as a result of coronavirus. I was not going to say on the contrary, but at least the level is definitely similar and still very high. So that's one thing. The other thing is that this heightened vulnerability is happening in contexts where humanitarian funding is a big question mark, because there is a lot of money that's being redirected to the domestic level, especially for, you know, the donors, the donor countries like Western countries, and the funding for appeal of the UN Secretary General, which was launched 24th of March, of $2 billion, is still lacking 75% of what it needs. So there's a big question mark on the capacity to deliver humanitarian assistance in this context of increased vulnerability. And as well, in relation to the difficulty for international staff of international NGOs and UN to travel around and being able to support, you know, a response wherever it's needed. And then maybe just two last points. One, what we see is that when the military is being put in a position to enforce law and public order, it's not something that, or it can be the case, I can imagine as well for private security, they're not in this position where they have been necessarily trained for it. And so it's a situation where you have the right cocktail and ingredients to have an increased level of tension between the populations and the military, especially that we are in a situation where people are very scared, they lack information, they do not necessarily have sufficient access to health care facilities or to treatment or testing. So so there's going to be, and we can speak to it in the rest of the of this conversation, there are a number of additional things and measures that the military have to have in mind in order to use restraint or exercise restraint in use of force, as well as at the same time make sure that the way they communicate with the population and with communities is very mindful of this potential for increased tension or increased instability.
Thank you for that. We will get on to in more depth during the discussion, but I want to turn to Caleb now. Caleb, if you could kind of provide us with the perspective from Kenya, which I understand has put a pretty restrictive lockdown in place and a curfew. As a civil society organization there, what are you seeing on the ground, and how are you seeing that, given that this lockdown is in place and it's restricting your movement, colleagues' movements, and the movements of other civil society organizations?
Okay, thank you so much. Good afternoon for those who are in the afternoon period, and for morning, those who are already still in the morning, wherever you are. Good. I hope you are having a good day. Okay, thank you so much, everybody, for being available this time to discuss the issue of having a responsible security in the midst of the challenges that we're going through. Probably I begin by just a brief view of what is happening in a place like Nairobi. Nairobi is under blockade, if I can tell. It's not under lockdown, but under blockade. No moving in or going out of Nairobi. And the entire country will have a curfew that runs from 7 p.m. to 5 a.m. in the morning. So this, with the topic of responsible security and ability of CSO also to monitor what is happening around. Definitely with the restricted movement, that comes a major challenge for civil society organizations. And as a country that has been undertaking security sector reforms for now over 10 years, we started honestly in 2009 to conduct public and private security sector reforms in Kenya. It is a real challenge, that was never anticipated. Or with laws that are just coming into place, that creates a framework for civil society to engage in monitoring the kind of security management that is taking place in the country at the moment, the role the public security is playing, and the role the private security is playing in Kenya. We have a military framework, and for your information, the government for the first time has recognized private security as an essential service, supporting the security framework during this period of pandemic. And in the first few days of the declaration of curfew, I know the public security moved in and probably caused even people to die. Few people died in the efforts to enforce the curfew. So, with the private security being allowed to operate, this is very critical for our reforms program, because now they can easily mingle with the public security in terms of administering or managing crime or security programming in the country. But there are some inherent challenges that also come with this. Like in some of our other sectors, one of the major challenges that there has been rise in kind of crimes, because there is minimal, actually, even the police are straight now. Private security guys also come into to play an important role, and we have cases where even private security players have been a target. But the major role of us as civil society organizations that are working on security sector reform is to monitor the conduct of public and private security in the course of their duty. But with minimal movements at the moment, I know our efforts are a bit curtailed, but we are always on high alert based on the networks that we have within the country, and also with our partnership with the government structures that are also in charge of monitoring what is happening in the private security industry. Usalama Forum, we work very closely with the Private Security Regulatory Authority. We work very closely also with the police, because we have also been part and parcel of the reform package that we have been advocating for a fairly long time. So these are part of the things that we are still inherently working with. But also, despite the challenges that exist in terms of movement restrictions, there are also very good opportunities for strengthening the engagement framework in terms of private security sector reforms in Kenya. This has come also with business opportunities. Because of restricted movements, people feel a bit insecure, and the security industry is also growing fairly fast. And also, it has also come up with another great opportunity in terms of training, professionalized training, in terms of health management. I've seen targeted training for private guards in terms of how they can conduct themselves in public places when they're risking the risk that they're exposed to. So there are some kind of specialized trainings that are also coming in as we continue with this new challenge. And also, we have seen very strengthened partnership between private security industry, government, and CSOs. It's a unique situation that has brought people together. And I think there has been a feeling that people need to support each other, so that we can continue strengthening the reforms that are taking place in the industry. Probably, Gami, Chris, I can just make that brief for now. Then we can continue talking as we move forward, so that we can give some people opportunity to ask one or two questions. Then we continue. Thank you.
Yeah, thank you, Caleb. You know, I can hear some themes coming out already. Beatrice has already mentioned training, as did you. Clearly there seems like coordination, cooperation between public and private security in Kenya. I wonder if that is going on elsewhere. As we know, private security outnumbers public security, not necessarily including the army, but certainly the police in many African countries and contexts. But Fred, can we move on to you now to get your perspective and the latest news from Nigeria? Tell us a little bit about the organization you work for and what the implications of the lockdown in Nigeria have meant for your operations. Oh, and you need to come off mute, Fred.
Sorry.
Oh, sorry.
Very much. Is that okay?
Yeah, we can hear you.
Okay, thank you. I welcome everybody once again to this webinar. Yes, the situation, maintaining responsible security from Nigeria, I can tell you up front that it's quite challenging. During this period, a number of activities that were not planned for or experiences that have just shown up that people didn't have prior to this time. Now, let me say that Nigeria, like we know, has unemployment issues, and as it is with a number of countries. And data coming out now from the economists are saying that there will be additional 27% in terms of projections to add to this number of unemployment. And so it already gives us a very serious, puts the country in a dilemma to manage this wave of unemployment. But let me go back to the first week of the coronavirus situation in Nigeria. The first case was on the 27th of February, the index case. And then Lagos State, where I am, Lagos State is the commercial center of Nigeria. Lagos State had the first incident, and then the state had to announce a lockdown before federal government announced theirs. Now, prior to the state announcing a lockdown, they gave some days, some window. So immediately that caused panic buying. So the first wave of insecurity experienced from our side is from the announcement of the panic buying. I went out to the malls within that period to observe some things. Now, what was the experience? The lockdown that was announced to come in about 2 days or so from the day of the announcement caused people to want to panic buy in different locations. And then I noticed that because the private security, usually these malls and some public places are manned by private security. So there was a challenge. They had a challenge trying to cope with maintaining order because there was a problem with maintaining the crowd and asking people to maintain the social distancing was a problem, even when they marked out the floors. So as a matter of fact, well, without going too deep, I saw in the course of a private security official trying to maintain order, how to push a woman, not out of, it wasn't his intention to do so. And that woman was pregnant. So I had to quickly scream, practically scream that, oh, look at that, there's a woman behind you. So he had to maintain that. So that gave a problem. Now there's the issue of restriction of movement. I drove through the city. My office, New Nigeria Foundation, is not far from the place I stay. So I drove to the office within the first week of the lockdown. And coming back, you notice that the restriction of movement, I wanted to see firsthand the experiences of people. So you notice that for the armed security, for them to carry out that instruction properly, there were incidences of going beyond what they were supposed to be doing. I saw people's car tires being deflated, just so that they can enforce the instruction on restriction of movement. And like I said about the unemployment, COVID-19 is a health problem, we know, but it's gone into bringing economic problems. And with spiraling into economic problem, it has exposed youths to wanting to take towards some acts that may not be consistent with what ordinarily they would have done. There are increased reports of robberies in neighborhoods, and there are, as expected, the security agencies, including the private security organizations, are the ones to withstand these people. And then it gave rise to Neighborhood Watch. The Neighborhood Watch, which is also, they try to keep security within the areas where they live. It gave rise to them wanting to enforce their rights of protection in their neighborhood. And then there's the issue of distribution of palliatives. It's a good intention by government, but you see, distribution of the palliative, because it's not so much, there were incidences of people, wanting to rush, wanting to be the first to get, and the teams that go around to distribute this are usually exposed to some kind of security issues. And it's usually a combined team. You also have private security men around them. You have the armed security. So even in solving a thing like distribution of palliatives, it's also breeding some kind of security issues within those areas where that is being done. And of course, there is an issue with cybersecurity as well. At this time, there there are 1 or 2 recorded cases from our perspective here where there's a spike in fishing activities in maize palm and such like. So, the maintaining responsible security at a time like this, where the COVID-19 has sort of heightened a number of issues. It has heightened the issue of like food security, like you mentioned earlier. Now, during the first week of the lockdown, New Nigeria Foundation, we went out towards our office area. A number of private securities are working around where our office is located. And they have operatives in this place, in these offices. So you notice that for them to do their job, yeah, I heard when Caleb said that in Kenya, they've been recognized as a team whose activities are classified as being recognized as essential service. But for us in Nigeria, it is only recognized as an essential service to the extent that they are free to move from their residence to their places of work. So that is the extent of recognition of, and they have to be on their uniforms or show some kind of identification card to show or identify themselves. So the private security in the places where they work, it's also a challenge even within the industry itself, because food security has become even difficult for them. Some of them have been locked up where they went to work and cannot return because they've been seized, in quotes, by the announcement of the lockdown. So maintaining responsible security is really a very big challenge from our perspective here, especially Lagos. Lagos is over 20 million people, and you have a population that is grossly on demand security-wise. So, and private security organizations really come to augment the gap, to cover the gap that is not covered by the, so we expected, although moves are on now, this has brought this kind of things, expose this now, expose this kind of situations. We expected that the private security should be given this kind of recognition where PPEs could be made available to them, because they are usually the first part of contact in any complex, office, home. I don't know if I still have that time. There's a hospital that had, where a high-profile government person just died. And then media reporters went to that hospital to capture the situation of things there. Every single person in that hospital has deserted that place. And I felt so bad that the only person left in that premises that the media could talk to are members of the personnel of the private security company. So it has caused a whole lot of security issues in our place here. Yeah.
Thanks, Fred. So, I mean, clearly, one of the issues here is that the private security companies themselves are facing increased risk. The health crisis has turned into an economic crisis, which has turned into a security crisis with increased crime. And it seems like, the security companies are on the coalface of the issue and in line with the risks. I just would ask if people want to submit questions to use the Q&A. We do have 1 or 2 questions start coming in. But I do now want to turn over to Frank for that perspective of the private security company itself. What have you experienced, Frank, in terms of this increased risk that there may be for your employees? Be good if you could kind of reflect on issues that have already been raised around training, whether there is a kind of coordination between public and private. How has this situation unfolded in Ghana and for Landmark?
All right, thank you, Chris, and good afternoon, good evening, or perhaps good morning to all the members on the call. I would just like to more or less continue from where Beatrice actually paused. And Beatrice, thanks so much for laying out exactly the different roles that the military or the security services can play and continue to play in situations such as this. But I think the key question or concern that we need to be asking ourselves is, what kind of supportive services does the security services provide? And are they being undertaken in the respective countries, i.e. to support the activities of the private sector, or to more or less advance the narrative of the government? You realize that in countries where these lockdowns were announced, there was the need for some enforcement to come. Most importantly, because they occurred all of a sudden. I mean, nobody really had anticipated we're going to get into a worldwide lockdown to this extent. And so moving forward, we need to also acknowledge the different roles that they have played in terms of bringing us this far. But I think more substantially to ask the question about whether these measures in the various African countries to contain the spread of COVID-19 has created more insecurity and increased tension among local communities. For me, it's key. It's key because I would argue that to some extent it has, especially in areas where there are other underlying issues, which again has been well laid out by Beatrice, or conflict, for which reason political leadership decides to use COVID-19 as a leverage to more or less come down heavy-handedly on the citizens. And we realize that in some of the countries, there's been new legislation that has been passed. They are implementing some laws that were on their books many years back that were actually not enacted during a democratic dispensation. And also the delivery of the support services, which ties in clearly with whether the security services have been trained sufficiently enough to meet some of these challenges that we're experiencing today. And also to be able to have that civil military coordination and collaboration to ensure that things are done in circumspect, more or less things are done with prescribed methodology or are done in the right perspective. Complementary to this is the basic survival needs of the people, which, when not met in a timely fashion, undoubtedly creates tension right at the local community level. And I think that is one of the things we're experiencing across most of the African countries. But narrowing down more specifically to Ghana, as long as I am here, I think I'm able to speak more to specific things in Ghana, other than looking at Africa in a broader sense. Ghana, as we all know, has a solid social capital, and hence, during the president's maiden address on the imposition of restrictions on movement, one of the key talking points was the fact that it's a collaborative initiative. And this is a key thing here. And these measures, as he announced, were to be executed primarily as a humanitarian intervention and not as a combative engagement. We all agree we are at war, literally, but not a war requiring military-style execution and including excessive use of force XYZ. So those are the two key things that I think the president of the country did put out there, which actually softened the approach that the military were going to do. And clearly, this shows how our leadership appreciate the basic rules and the basic rules respecting and protecting, let's say, the human rights of its population. And this actually went a long way to address some of the human rights concerns that we are seeing or we are hearing from other African countries. We also need to see it more as a trickle-down approach where those are the top of the pyramid, more those in political leadership, understands the requirement. And that is key. If the leadership does not understand the requirement, then what is going to happen is that they'll do things that do not fit in the scheme of things. They understand, they believe in those requirements and are committed to ensuring the right things are done. Someone may ask, did we have some isolated incidents reported in Ghana? Yes, we did. But then again, we are looking at how swiftly this reported isolated cases were actually handled and at what level of the military command structure were those handled. Overall, I see the government of Ghana's handling of the lockdown measures fitting appropriately within the best practices, within the best practice context. And also in line with the excellent publication, and I'm sure a lot of people have already read it, by Beatrice on what the military can do to better protect civilians in conflict countries affected by COVID-19. Although our country is not really in conflict, the underlying principles are key. Understanding the role of the military, looking at the collaborative engagement between military and civil society, what role, or even in terms of how the private sector participants are actually seen within their respective countries. In Ghana, for instance, during the announcement, security services were considered as part of the essential service category. The Ministry of Interior had a meeting with the association, generated or gave some security passes to all the military, to all the private security operators to give to their guards, so they'll be able to freely conduct their activities. There was an ongoing, and we continue to have that collaborative engagement with the police service, which we fall under, and also the military, in how we can actually manage some of these things. One of the things that we have seen, and this is also dovetailing back into what Khalid said in terms of the opportunity that we are seeing, we honestly had to look at how we can re-engineer ourselves to fit within this particular lockdown scenario. A lot of the companies were not prepared. We were, because we had anticipated how things were going to do. And one of the things we keep telling ourselves is that you are better off over planning than under planning. And so a lot of these things actually came in, and so it was quite easy on us. And I'm sure a lot of the private security providers in Ghana would attest to the fact that we have had quite a success in terms of managing the relationship between the state security or the state forces and also the private security. Maybe at this point, I'll just pause and then we can carry on with different questions that will bring out more of the conversation as we go on.
Beatrice, I see your hand up.
Yeah, can I just follow up on a couple of points?
Sure.
Yeah, thank you so much. It's wow, it's so interesting to hear from all of you being in the field. While, you know, Chris and I are sitting here in Geneva. So a few points. Two, I think that was Fred who mentioned the challenge for security forces with regards to the fact that they are also vulnerable to the outbreak itself. So one of the area of recommendation we provide to security forces which are in these environments is indeed to work even more than usual on balancing out the force protection aspect with the do no harm aspect. So force protection being indeed all the measures that they first and foremost need to take to be able to protect themselves in, before being in a position to actually protect potentially others. And that includes PPE, masks, etc., but also social distancing, which what I've heard from my colleagues in the field, being in Africa, in Ukraine or elsewhere, it can be, of course, a real challenge. And if people see, militaries in a shop or not respecting, or in the street not respecting this social distancing while they do have to do that, it's increasing the tension as well. So definitely force protection, and at the same time the do no harm aspects. So making sure that in the way they behave, they do not contribute further to the dissemination of the outbreak. Second point, in the expertise or training that needs to be developed to increase the capacity of the security forces, there's a strong message that needs to be passed on focusing on the population. Because very often it's about a specific, so for the military it's going to be a military objective, for private security it's going to be a specific contract, but at the end of the day, the focus on the populations, again in terms of do no harm, but also in terms of being able to decrease potential tensions and address the vulnerability of communities is going to be essential. And this focus on the population needs having a much better analysis on the needs that they have, and on their need to access healthcare and security. And factoring that in the way you do, I think Frank, you mentioned very well, the need to actually be better at planning and anticipation. That's part of the planning component, which needs to be reinforced. Of course, then there is all the different, trainings and sort of guidance that they need to have in terms of respecting international and national human rights law and international humanitarian law. So in terms of avoiding victimization and discrimination, etc. But it's a huge challenge, again, if you have not been exposed to these concepts in the past. And then the last part is the civil-military coordination. Thank you very much for raising it. It's absolutely essential because that's one, the outbreak response, it's where you have together security forces, public health agencies, and all the rest of the civil society and civil agencies all together in the civil space to deliver a response. And even more, I would say, than before, you need to have a level of coordination in order to deconflict potential issues, to make sure the prioritization is being done in the right way. And of course, to just have a proper level of communication. Then my last point is when it comes to communities, again, when I was saying put the populations and the population needs at the center, I think in what Caleb also mentioned was really important. There is indeed a way to monitor or to stay in touch with communities and to monitor the situation on the ground in spite of the quarantine. It's a challenge. We all do a lot of phone calls and Zooms, etc. But for civil society organizations who already have a network established, indeed, all of us, I guess, we've put in place regular phone calls with community leaders or CSO contacts in order to have a sense of what they're seeing on the ground, the type of needs that they're looking at. So I would really like to encourage, at Civic, we've produced recently this paper kind of putting together what we've heard from communities. It was in Ukraine in the instance, but I would really encourage other civil society organizations to do that as well. I'm sure they're collecting a lot, but to provide visibility on this information that they're collecting from the people on the ground so that we understand better the potential threats and that it can better inform the response, both the private security response, the business response, the public response, and so on and so forth. So thank you everyone for these comments. It's very inspiring.
Coordination seems to be the key in much of this discussion. And I think I mentioned at the beginning that the African Union was really praised for the level of coordination at a very high level that happened, but it seems like this has to trickle down right down to the community level. I'm just wondering if there are any examples of how that has happened practically from any of the members there. I mean, Beatrice, you've mentioned kind of phone calls and Zooms, etc. Do we have practical examples of how this coordination has worked between particularly the civil society and the military and regulators? Frank?
Yeah, so thank you. I think, scanning through all the different COVID-19 task teams that has been established in various countries in Africa, you realize that all of the teams have different representation from different sectors of the economy, which a lot of time includes civil society. As to whether the role of civil society in those task teams are visible or are amplified is another conversation for another day. But one of the key things I wanted to put across to is the fact that a lot of the countries were not actually prepared for this kind or this scale of pandemic. Like Beatrice said, Ebola happened in very few countries and there was a lot of resources mobilized to support it because we wanted to ensure that globally people are secured. And so it's good to more or less attack the virus in its domain rather than exporting it out there. But it is also key to understand that it's an ongoing activity. And for me, I think the measuring indicator, the measuring tool for us is about how governments have acknowledged the fact that this is an ongoing existential threat and the fact that they are resilient enough to actually engage on a day-by-day basis to correct the wrongs. We know countries where they seem to be democratic, but they are not. And so this comes to add another layer. And so what has been the response from leadership? Are they inclined to understand or to believe in the fact that this is a public health emergency and for that reason, we should put everything aside and try to address it to ensure that we are providing sustainable livelihood for the people at the local community? In some of the countries, look, they've been doing food ration and all of that. Even identifying the vulnerable groups, it's a challenge. It's a challenge because the systems are not matured sufficiently enough like what you have in Europe and in America. So you are having to deal with these survival issues on a day-by-day basis, at the same time trying to address the security situation as well. Although the pandemic is ongoing, government machinery must run as much as possible. only that there's a lot more focus on the security aspect of the COVID-19, and for which reason you need to make sure that people are safe first and foremost before you can more or less come back to the issue of economics. So it's a delicate balance that a lot of the government are trying to meet. So I would want us to acknowledge the fact that people are doing what they can do under the circumstances. And there's always a saying that if all the tool you have is a hammer, then anything you see actually, I mean, if you see a nail or whatever you see, I hope I'm getting it right. Everything you see, it's like the only tool you have in your toolbox is a hammer. So everything you see, you need to use a hammer to hit at it so that you can get relief. But of course, the government wouldn't want to be attributed or ascribed to the fact that they did not do anything to protect their citizenry. And so they'll do whatever it's in their power to do that. But we need to, more or less with civil society, become the guardrail to ensure that they are focusing on the conversation, keeping an eye on the issues that are coming up and encouraging government to do what is right for their people. And so that is what I probably wanted to put in across so that we all have the conversation in the right perspective. Europe's approach might be entirely different from the approach we would undertake in Ghana or for that matter in Africa or even in Latin America. But this calls for specific context-driven activities that are being guided by the public health and the science around the disease spread. And so that is something that we need to more or less put on the packing board and be able to link different conversations to the same thing as we move along.
I think, Frank, because of the risk, because of the low level sometimes of democratic values in Africa, in our continent, I think this is why the role of civil society become very, very key in monitoring exactly what is happening so that private security industry, as it continue playing a central role in security infrastructure in most of our African countries, we don't run the risk of some of them turning into a military or a paramilitary or military outfit. Yeah, because you realize that some of the people accused of intimidating or presence that are accused of violation of human rights, you see them taking a very strong armed tactics in terms of how to manage the pandemic in their own countries. So this is why the civil society must be always alert all the time. Everybody listening, even if it means setting up networks in the countries, so that you can be hawk-eyed in monitoring exactly what is happening in terms of dealing with security matters related to the pandemic. Otherwise, we can easily lose the democratic achievement that most of the countries might have picked. So that is why it is important always to be on alert as a society organization in monitoring the role that private security players are playing in this situation at this point in time.
I mean, Caleb, yeah, I agree, Caleb. And I mean, like I said, in my opinion, the civil society has a perpetual voice, which must not be taken for granted in any instance. Contrast that to the real voice of the population, which perhaps happens one time in every 4 years because of an election or even more. And so the civil society becomes the key point for entry into ensuring that some of these standards are maintained. I mean, even without COVID-19, we still had issues with private security people, some not being trained properly, some not working responsibly in some of those areas. And also that is where ICOCA comes in to ensure that we have responsible private security operators across the globe. So yes, those are things that we need to keep an eye on. The fact that some governance systems are weak in some areas is also more like a catalyst for things to happen at the blind side. But if I am focusing on my small area, I would never be able to know everything as I'm. But you have civil society across almost every sphere of our economy. I mean, if you do the stick with that mapping, you find them in different places. And sometimes they more or less are like the early warning system, sending out the signals that governments can act on or the international community can act on. So yes, I agree. Civil society has a bigger role that they need to play in all of this conversation.
And Frank, you've preempted. I want to kind of allow some time. We've only got 10 minutes left for some of the questions that are coming in. I'm going to go with last first. You've preempted this, but ICOCA is obviously a multi-stakeholder organization, so it does include civil society organizations, private security companies themselves, and government. But the question is, how does the code and the association help ensure adequate response to the security challenges in this COVID context?
Okay, so I think, and I'm sure we've had a series of discussions around this. The code in itself is fantastic. I think the issue now is about the operationalization of the code and how that translates to the lower level. I mean, and you can use Ghana as an example. How many private security companies are actually members of ICOCA and believe in the tenets of ICOCA? A few, and I'm sure you are very much aware of that. Is it worrying? Yes, it is worrying, because the more people we get, the more we are able to amplify the conversation and get the right things done. But one of the things that I keep saying, if it doesn't affect the bottom line of any business, then it doesn't become something that is a to-go thing. It's a nice to have thing and not necessarily a key ingredient in the overall conversation. So again, it comes back to ICOCA. We should probably be asking, how well are we able to translate the different code principles into different sectors of the different economies in different areas across the globe? That is the key thing we all want to have. And I tell people, look, the more responsible security companies we have across the world, the more it amplifies the conversation and helps us to also make better returns on our investment. If people understand that these companies are certified by the code, they are playing by the rules, and I can be assured that they'll do the right things to meet international standards. And of course, it increases the premium more or less for every company that is operating in that area. So, Chris, I think we need to flip it back again to ICOCA and ask, are we going to see some major changes in terms of translating the code into the specific areas or translating it to the lower level where we can have a lot more engagement from everybody who is actually working in this area as well? I hope we see that soon, so that it makes it more easier for us to operate in different areas.
Yeah, and I think, you know, a kind of key constituency that we don't necessarily have represented here are the clients of private security companies. And those are governments, you know, large multinationals, smaller companies as well, of course, as many humanitarian organizations, you know, operating in Africa. And I think, you know, there is absolutely a need to shine a spotlight on the role that clients play in really driving the market. And the market has been massively impacted by this COVID-19 pandemic. You know, we have seen many of our members who have services for mobile security, for example, it's kind of evaporated overnight. We don't know what private security is going to look like post COVID-19. And that brings me on to kind of the next question that we have is, from the perspective of helping and informing companies and CSOs, as restrictions are lifted, are there ways that the panelists think the industry will need to change and adjust?
Yes, I think the industry needs to adjust. I mean, things will never be the same again. Our world is honestly changing in so many dimensions that we can't even grasp our hands around. So I can say for sure that things are going to change. The question is, are we going to be able to meet that change and be able to deliver for our clients, or be able to represent our countries and do what is expected of us within the conversation space? Maybe yes, maybe no. But then again, it comes to what support will be available from the umbrella organization to individual companies operating in both fragile and countries and all of that. So yes, things will change. Things will never be the same again. That one is sure. I'm sure everybody is certain about that. But are we going to be able to manage the change? Maybe yes, maybe no. So maybe we will need to probably have a separate conversation on what are the opportunities or what are the futuristic needs or the gaps that are going to come post-COVID-19. And then we can try to support each other in this space. It shouldn't be more of a competition because anything that has an existential threat, competition needs to be put behind the scenes so we can actually deal with the existential threat first and foremost. And then we can come back to the work as usual. But I think we need a much more broader conversation around these areas and be able to support ourselves first and foremost.
Yeah, I think that to quickly bump in there, the support and the changes that we desire to have, one key thing that will support or that will aid this is the issue of data availability. in the private security sector, and I speak particularly from Nigerian perspective, the data is not available. So any collaboration, efforts, and support should be from the perspective of, let's even generate sufficient data that will guide the monitoring we're talking about, that will guide the cooperations we're talking about. How do we even support, even to hold people accountable in the sector, whether as private security organizations or even public security, but particularly the private security. How do we hold people accountable if we don't even know where they are, who they are, and then to also support them, the data. There's a need to work with the private. In Nigeria, there is a private security association that exists. So the CSO, the umbrella organization, the private security organization in Nigeria need to all work together. And ICOCA, and indeed ICOCA, and any partner that could support this, to work together and develop the necessary data that will drive informed activities, informed decisions. I think that would be very crucial.
I think already change has taken place. About whether the system might change. Already the pandemic has thrown the entire world and the system, how things have been operating. Everything has already changed. There are countries where there are structures that support the private security industry's professional growth. There are countries that do not have structures yet. There are countries that do not even plan to put the structures yet. This is the point ICOCA will play a very, very central role in terms of building global framework that will clearly chart the way that the private industry is going to play in the next politics. The pandemic has thrown everything into play. Let me give you an example. Kenya, we already have a private security regulatory, a fairly new framework to help guide the changes within the private security sector. And I know it was formed before pandemic came. Probably because the pandemic has come, there are certain things that might even change how the authority operates, how the government perceives things. Because the real impact of pandemic, I can say that nobody still knows how far it will go. But now, if it eats better, if it decimates populations, what will happen? I think this is the point of time we as civil society organizations, I think this is part of what I said before. We need to strengthen our networks through ICOCA. ICOCA has developed several instruments that we can use to strengthen monitoring programs within the private security industry, because it is very, very clear that the private security industry is going to play a very, very major role in terms of building stability, in terms of industrialization. So this is the point where we are. We need just to strengthen our networks, probably at the continental level. We have the observatory framework for Africa, and I'm very I can see now 74 participants are still online watching us. Probably through ICOCA, we are going to provide leadership so that we can build a strong network. Because with strong private security industry, we will have a strong public and responsible security. And this will help in enhancing democratic values within our society, and then it will bring development in the long run and reduce crime. Probably that's my take.
Thank you, Caleb.
Do I have just 1 minute?
Beatrice, I know you had your hand up, so you get the last word.
Okay, no, sorry. Just two things. One, I agree that we're going to have new challenges, but along the same line that what Fred say, all challenges are still there. Data is one of them. Operationalization of the code is one of them. Number of companies, number of CSOs, number of governments which are part of ICOCA is still a huge challenge. So there's still a long way to go. And the issues that were there before are still here after, in the world of after, so to say. And in addition, that's the same for civilian populations. That was, speaking from the perspective of populations who are already vulnerable, including in unstable and conflict countries. The additional vulnerability that they are facing during the acute phase of the COVID is not going to go away. On the contrary, we can expect, everybody's trying to, see what unstable places are going to go through in the next 18, 24 months. But definitely there is risk of increased instability increased fragmentation of actors, increased space for criminal activities, and so on and so forth. So definitely the code is even more relevant, I would say, in this situation. And tools, I mean, okay, the tool is at a high level. ICOCA has already produced, you know, very practical tools such as the PSA guidelines, so for sexual abuse. And I think we should definitely go in this direction, that the code is being translated into very practical actions, trainings, etc. And that's really what the ICOCA is doing, because these challenges are going to increase in the future.
Thank you so much, and thank you all. It's very difficult to kind of summarize this conversation, so much has been touched on, but there are a few kind of themes that have come through to me. I think I mentioned before that collaboration seems to be absolutely key at all levels. That is what ICOCA is really about. It's a multi-stakeholder organization, and it brings these stakeholders together to collaborate. It's not always easy, but that is the aim of the game. Training is clearly an issue, especially in a dynamic situation like this, where things are suddenly scaled up massively. We haven't been able to kind of go into detail on that, but I think that's, you know, potentially topic for another day. I mean, for me, and listening to you all, what is key as well is communication. And you know, the reason why we are holding a webinar like this is really to allow these perspectives to be heard, to engage with our network as much as we can. And this is just the start of the conversation. It's an incredibly dynamic context that we're talking about. It will be changing a lot, and we are eager to stay engaged with you all as we kind of carry on this journey. Change will be a big element of it. Let's see where it takes us, but ICOCA definitely has a role to play, and we look forward to working with you all to really carry forward implementation. And we hope, you know, one day, not in the too distant future, to have the first African government joining on board with the association. But we will leave it there for today. And I look forward to carrying on the conversation. Thanks, everybody.
Thank you very much.
All right, bye-bye.